So surgery for low back pain or lumbar spine pain. Normally lumbar spine pain, which is this area of our spine, it is known as the lower part of the spine. So it is very common to have low back pain. Now, what are the causes for low back pain? Either there is a problem with the disc, or there is a problem with the bone, or there is a problem with the joints of the spine, or there is a problem with the overall alignment of the spine. So in majority of the cases, if it is simply a disc related issue, through medicines, through exercises, we are able to treat the low back pain. Now, in situations where there is a slip of the bone, or the joints are not working well, or if there is a effusion of the joint, then we might require to do surgery for this. Now, the most common type of surgery that is required for treatment of low back pain is the fusion surgery. For the fusion surgery, supposing if this is your vertebral column and there is an abnormal movement which is known as spondylolisthesis, in which the bone is slipping forward. In that situation, we use screws like this. So like this is a typical screw that we use for spine surgery. We put screws in the bone like this, and so that the bone is held firmly by these screws, and we keep on putting these screws at subsequent levels. Like if this screw is put at this level from both the sides, this way, then we put similarly screws at the adjacent level on both the sides, and finally we fix all these screws through a rod like this, so that it becomes one strong solid construct like this. So this kind of surgery is known as spinal fixation surgery. Now, fixation is just one part of it. We require fusion also. Fusion means that we want the bone to form between the bones so that the movement is totally abolished. For that, we put intervertebral cages like this. Now, these intervertebral cages, they are put between the two bones. Like this is a bone and this is a bone, and we take out this disc part and we put cage here. So the way most commonly type of surgery that is done is transforaminal lumbar interbody fusion surgery, which is known as TLIF surgery. So in that surgery, we put screws in the bone like this. We join them using rod like this, and we put intervertebral cage here like this. So this is known as TLIF surgery. Similarly, we have other forms of fusion surgery also, which is known as posterolateral fusion surgery, in which we do fusion between these two things. These things are known as transverse process. So fusion between these two things is known as posterolateral fusion. Similarly, we can do XLIF, which is fixation through the fusion through the anterior part of the body, or we can do OLIF. In OLIF, we do oblique lumbar interbody fusion, which is a fusion through this part of the abdomen. We give a cut here, and the entire surgery is done through this part of the abdomen. So overall, whenever there is abnormal movement in the spine, or if the bone is incompetent, or the joint is incompetent, or the disc is not working well, and we need to do low back pain surgery, the surgery is normally known as posterior lumbar fusion surgery with fixation surgery. And these are just few different kind of surgeries that we normally do. Now, this surgery can be done through an open conventional method, or it can be done through minimally invasive technique also. In minimally invasive technique, when we do these surgeries, the scar is small, bloodless is very less, infection chances are low, rehabilitation is fast, and the patient is able to return back home very quickly. So if you are suffering from low back pain and your doctor has advised you surgery for low back pain, these are few commonly done procedures that are going to help you in your low back pain treatment. Thank you.